Hello, my name is Eden. I live in Uganda and I'm currently a student in Kepra University program in Kigali, Uganda. So I'm going to introduce my video called Collaboration Among Community Health Workers and Health Facilities Promotes Family Planning in all communities around the world. So my video has two parts. One is a narrated video talked about the key concepts about family planning, the importance, the effect, and so on, the main point every person needs to know about the family planning. So also that part is talking about the importance of collaboration about community health workers and health facilities. And the other part is about the testimony of mother couples about the family planning. Thank you. Hello, those are the key concepts every person can know about the family planning. Family planning is the practice of controlling the number of children one has and intervals between their births, particularly by means of contraception or voluntary sterilization. Those are effects of not using family planning in our community and society overall. So, without using family planning, you can have street children because parents are going to give a birth for many children which are not able to raise. Also, mother mortality because family mothers are going to give over birth for the children and they can get some consequence of dying while they're giving birth. Also, there's child mortality because parents are not going to have facilities to help. So those are the importance of family planning to the development of the population. Meeting the need for family planning can reduce population growth and achieving the SDG goals of reducing the child mortality and improving the maternal health. Also, it improves the quality of education because parents get time to follow up the study of their kids and they are able to afford to pay their school fees. Also, it promotes well-being and good health because parents are able to provide balanced food. So the challenge that hinder family planning in our community and the world, especially here in Africa, so many adolescents are not aware about the method they can be used to stop those unwanted pregnancies. So other people have myth about the effect of the family planning. For example, some women think that when they use family planning, their husband are not going to love them as they used before to love them. So also some contraceptive methods are expensive in some areas, especially in Africa, to afford to buy. So ways to overcome these challenges that I have listed above, teaching the adolescents about the family planning and the raising awareness of family planning in our community. Countries need to invest more in family planning, such as the decentralization family planning method, because some countries they don't put much effort in family planning. So raise awareness of importance of family planning in the community because some community are not aware about the importance of having family planning. Also, we need to promote the collaboration between health centers and local community health facilities because it's the most key that can help to raise the awareness of the ways or the challenges the community face about the family planning. So those are importance of collaboration between community health workers and health facilities. It's help to connect people, especially in rural areas, with health system because some people in areas are not aware about the system used, not the difficulty the people have within the method of contraceptive and less awareness about health planning. So these are the statistics show how the collaboration among community health workers and health facilities promote the family planning in Uganda. Thank you. So here is the second part of the testimony of a family called of Muhoza and Anita about the way they help community workers, connect them to health facilities and help them to get the method that can help them to have a better health family planning. Also, this continuous video is going to talk about how the collaboration between health community workers and health facilities can promote the family planning in our community. So by continuing the second part of testimony, I'm going to give you testimony of Muhoza Anita and her husband when they went to hospital for removal of the method they have been used for 5 years. It was in the morning and they go to health center for remove the method they have been used for 5 years of a period. So when they reached there, the nurse helped them for removal. But the end, they asked her for changing the method and shift to another method. But the nurse, because she was thinking that the method is working for many women in the community, she refused to change for them because Muhoza Anita and her husband failed to explain well about the reason why they want to shift from one method to another. So they argued with nurse, and the nurse gave the appointment for tomorrow to meet with the director of health center community. So when they reached home, they called community health workers Batamuliza by explaining how the issue they have with nurse for refusing for removing the method they have been used. So because the community health workers Batamuliza was already know the problem and difficulties Muhoza Anita and her husband had with that method. In the next morning they wake up and go to see the director of health center of children. So the Batamuliza was able to explain about the difficulties Muhoza Anita and her husband have within the method, and the director of health center agreed to change them to shift from imprint to injectable. So both family of Muhoza and director and community health workers Batamuliza were happy because people all were able to get what they want. So this showed that collaboration among community health workers and the health facilities can promote family planning, because community health workers are those people who live together in the same community with people every day, and they know their problem, difficulties they can get with any given family planning method. Thank you.